Since Korea introduced travel restrictions to ensure public health, and in today's edition, we'll take a look, that is, at the impact of these measures. But first, as always, here are the headlines with our Kwon Soa and Noaram. Welcome.
Hello.
Hi. So we'll start with you. Let's start with the updates here in Korea. I understand we have less than 10 new cases today.
Right, we have 8 new cases today, so the numbers are looking pretty promising this week. And it is because of that decline that the government today announced an adjustment to the operation of hospitals that were especially designated for COVID-19 patients. Around 70 hospitals were in charge of treating only coronavirus patients with some 7,500 beds. And this move helped to reduce the chances of viral infections in patients being treated for other conditions. Authorities now decided to keep the number of hospital beds between 1,500 and 2,300 and gradually cut the number of hospitals designated to deal with COVID-19 patients. And that is expected to happen in 4 steps, with 12 hospitals that have no more COVID-19 patients being removed from the list first.
I see. Staying with the medical staff, I understand the government campaign of gratitude to health professionals, the 덕분에 campaign.
Yes,
right?
you showed that on our earlier broadcast, right?
Yes, I did. And it's gone quite viral.
Exactly. In fact, today, a senior health official, Yoon Tae-ho, he at the earlier briefing, the government briefing here that we're seeing, said he showed a badge at the government that we're seeing right now, which has been designed with a Korean Sign Language gesture that stands for respect and self-confidence. And Yoon said more than 2,600 citizens have so far participated in the so-called 덕분에, or thanks to you challenge. And with that, on behalf of the government, he thanked all the doctors, nurses, medical staff, as well as everyone involved in cleaning and sanitizing hospitals. And now let's take a look at our daily updates. Now, as I mentioned earlier, the hospitals designated to treat COVID-19 patients will be reduced, and that is because the number of people discharged from isolation and hospitals far exceeds those in treatment or quarantine. As we can see, more than 8,400 have now fully recovered. Meanwhile, we have a total of 10,702 cases, with the additional 8 cases today, and 2 more people died of the virus. Now, moving over to our map, the latest new cases were confirmed in the city of Daegu, with 4 cases there, 1 in Busan, 1 in Gyeonggi-do province. And this Thursday, it looks like just 1 case was reported as an overseas infection.
I see. And speaking of overseas, the U.S., I understand, is fighting 2 battles, one against the virus and the other against an economic fallout.
Right, and that is why U.S. President Donald Trump made an announcement, and he has been foreshadowing that on his Twitter Monday local time, and that is according to him, related to the limitation of immigrants. So let's see what he had as a reason for this move.
In order to protect our great American workers, I've just signed an executive order temporarily suspending immigration into the United States. This will ensure that unemployed Americans of all backgrounds will be first in line for jobs as our economy reopens.
President Trump claimed it would be wrong for Americans who have lost their jobs to be replaced with new immigrant laborers. He said the immigration policy should ensure Americans will be first in line for jobs once the economy reopens. The order is to last for 60 days, but could be extended. According to the Migration Policy Institute, the order is estimated to block the issuance of some 52,000 green cards over that period, but it won't affect temporary work visas. Critics are accusing Trump from using the pandemic for his long-held ambition to reduce immigration in the country, especially as the November presidential elections are coming up. Experts say the executive order may face legal challenges. Now, meanwhile, staying with the U.S., now the U.S. has 4 times more cases than most other countries in the world, with 837,947 cases. And Italy, meanwhile, the death toll there has surpassed 25,000. And Turkey is nearing 100,000 cases in total cases. And meanwhile, 2.6 million people around the world have been confirmed with the virus in 210 countries and territories, with more than 184,000 fatalities, and more than 717,000 people have made a full recovery.
All right, so thank you for those figures. Meanwhile, Aram, I understand there's been some progress being made between the ruling party and the government regarding the emergency relief fund.
That's right. The Democratic Party has suggested that all citizens, if we remind everyone, to receive emergency funds. The government, meanwhile, wants to provide the funds to the lower 70% income bracket, and there has been some disagreement there. But as a compromise, the DP suggested giving funds to all citizens, but also to encourage the rich to donate back some of the money that they receive in order to reduce the fiscal burden, and a kind of a hint at the goodwill of the upper class or the high income earners. The ruling party said it has notified Prime Minister Chung Se-kyun of the proposal, adding that he responded positively to it. Chung was also said to have relayed the proposal to the finance minister, who was also open to the idea. The DP also seems to be worried that the main opposition is actually cozying up to the government following its disappointment in the recent general elections, as the main opposition has also agreed with the government's plan to give funds to the bottom 70%. And there is, of course, a sense of urgency to finalise the criteria for this emergency relief fund. And so all relevant parties are quickly moving to reach a compromise.
And there's been much debate over when this pandemic will blow over, but the Global Health Organization does not think it will end soon.
That's right. The WHO chief had a stark warning for the world leaders. Have a listen.
Most countries are still in the early stages of their epidemics. And some that were affected early in the pandemic are now starting to see a resurgence in cases. Make no mistake, we have a long way to go. This virus will be with us for a long time.
Yes, and during that virtual press conference, he did note that there has been progress in Western Europe, but did warn against complacency. The countries that are showing what the WHO has called worrying upward trends are those in parts of Africa and Central and South America, as certain countries with slowing cases are starting to gradually resume normal life, including here in Korea. The WHO chief said such relaxations needed to be managed carefully. He added that lifting lockdowns could cause infections to reignite. He also defended the WHO's handling of the outbreak, saying that the UN agency warned the world of the virus early enough. And of course, we've been hearing a lot of criticism surrounding the UN agency for not doing well, especially from the US, with President Trump calling it China-centric as well.
Right. Now, the government here is poised to launch a task force to handle requests for assistance from its counterparts worldwide.
That's right. Korea, as we've been mentioning many times on the show, has been praised by the international community. And a task force under Korea's COVID-19 Command Center will be composed of officials from the Health Ministry, Korea CDC, and other relevant government bodies. It will be led by Second Vice Foreign Minister Lee Tae-ho. The task force will hold meetings every 2 weeks on how to share the country's expertise with other nations. This could be in the form of online seminars, video conferencing and policy sharing, as well as many other methods. Some 40 countries are said to have reached out to Korea so far, asking for advice on Korea's border controls, testing, quarantine management, etc. Seoul has also been exporting hundreds of thousands of Korean COVID-19 test kits.
All right, Aram, thank you for that. It's a little after 2 in the afternoon here in Korea, and we're poised to join the Central Disaster and Safety Countermeasure Headquarters for the latest briefing on the COVID-19 situation here in this part of the world. Korea has been reporting fewer than 15 new cases for the 5th consecutive day, but health authorities are calling on the public to remain cautious. As they point out, all it takes is one person to start a second wave of infections. Now, Korea confirmed its first case on January 20th, and on February 29th, it marked a peak of 909 cases before the country saw its lowest daily count of 8 this past Sunday and also today. Meanwhile, as our Noara mentioned, Seoul is poised to form a task force composed of various government agencies to better respond to requests for quarantine information from its counterparts across the globe. While we also wait, we ask you once again to take part in the 덕분에 challenge, the Thanks to You challenge, where you place your left hand as a base and put your right hand with the thumbs up sign on top. Please send us your pictures of yourself with the 덕분에 challenge on our social media accounts or our homepage, arirang.com. Here now is the briefing.
Let us now begin our regular briefing for April 23rd, Thursday. We have a total of 10,702 confirmed cases, and among them, 78.6% or 8,411 have been discharged following full recovery. This includes 1,021 imported cases, and among them, 91.7% are South Korean nationals. Yesterday, we had a total of 8 new patients, and 134 more people were discharged following full recovery as of yesterday. And unfortunately, we had 2 more fatalities. And I send my deepest condolences to those who have passed away and the members of the bereaved families. And the regional breakdown of the confirmed cases is as follows. We had 8 new cases, and among them we had 4 imported cases and 4 community infections. And as for the community infections, they were witnessed in Daegu and Gyeonggi province. And nationwide, 80.9% were related to cluster infections. Looking at the sources of infection for the last 2 weeks, we have mentioned this for numerous times. 56.6% are imported cases, and 6.1% are those infections through these imported cases. And yesterday we had 4 imported cases, and they were 2 were from the Americas, and 1 was from China, and 1 from others. And by region, we had cluster infections, and here are some details. In Gyeonggi-do province at Pocheon at the Hansong Medical Center, we had screening testing on all of the patients and staff members there, and we have 1 more confirmed patient, making the total to 7. At the Daegu Seoul District Hansarang Nursing Hospital, we also did an investigation onto these cases, and we had 1 more positive case, and making the total to 128 cases in that specific hospital. The therapeutics and vaccine for COVID-19 is being supported by the Intergovernment Task Force. And this Intergovernmental Task Force, Working Level Task Force, we had a second round of meeting yesterday. And in order to listen to some of the challenges on the site, we have set up these task forces by category. And we have discharged and disclosed the contacts in the press kits. So if you have any inquiries, please make use of your contacts to these facilities. And they also look at any challenges that occur on site, and they link to these inquiries to the specific working level task force staff members. And the KCDC is carrying out social distancing measures until May 5th. So we once again ask the public to take part in our measures going forward, especially when you have close contact within enclosed spaces. We ask these places to refrain from operating as much as possible. And if these facilities need to be operated, all of the users need to have their body temperature screened and have a visitor log, and they need to wear face masks, and they need to keep a social distance, and also they need to have a regular ventilation as well. And here are some of the recommendations for our public. The WHO and the quarantine authorities of the US believe that we could have a second wave of infection. And currently, regarding COVID-19, the global pandemic is sustaining and it's happening continuously. And it is inevitable for even if it's not, if we can't and if we don't close down the borders continuously, we will have continued contagions and we will thus have continued infections. And the SARS or the MERS that we have experienced in the past are different from COVID-19, as COVID-19 has asymptomatic infections and they have high rate of infection as well as infection at the very early stages. And South Korea does not have abundant amount of information on this virus as of yet, and we do not have an effective vaccine or therapeutics to treat the virus. And as we mentioned before, we believe that this is a crucial moment to prepare us for a next possible outbreak. And that is why we need to make a transition into the everyday life quarantine, and we need to focus on R&D going forward. And the development of vaccines and therapeutics, as well as discussing the importance of the control equipment, the experts of these task force also suggest that we need to prepare ourselves for a possible possible expansion of the ICU. And we are also carrying out an amendment to the regulations in relation to these developments. And what we would like to urge the public is that on top of the everyday life quarantine, as for the high-risk groups, we would ask you to keep and abide by daily health guidelines so that we can be fully prepared for another outbreak. And as for the high-risk groups, they need to have an improvement of their unhealthy lifestyles. For instance, smoking and obesity are also included in these high risks. So adjusting your weight as well as cutting down on your smoke is also very important. And as for children, the mandatory vaccinations are very important. And coughing etiquettes are also something that's important, that they need to be educated. And as for adults, if you have underlying diseases, you are in the category of high risk, and if you have and you're advised to have medical checkups for many diseases, including cancer. Swift identification and treatment and diagnosis is very important in treating these underlying diseases. And when we are prepared at an early stage, we believe that we can overcome any types of infectious disease. When we look at our past and our battle against COVID-19, we would like to highlight that on top of the everyday life quarantine, we need to get ourselves healthy to prepare for another possible outbreak.
Right, that was the afternoon briefing for this Thursday by the Central Disaster and Safety Countermeasure Headquarters. So give us a wrap-up of the key announcements then.
All right, Vice Chief of the KCDC, Kwon Junok, said we have 8 new cases, as I mentioned before. And with that, he noted that for 6 days, we had cases, less than 20 new cases on a daily basis. And with that, we have 81% infections related to cluster infections. And the Vice Chief, he stressed that we should all cooperate in carrying out the social distancing measures until May 5th before we transition into everyday quarantine. And the importance of that everyday quarantine is because there is a chance of a second wave of infections, which he has been emphasizing at today's briefing. He said it's inevitable to have more infections. New sources of infections are possible, and that is especially important as we do not have vaccines or treatments yet, and officials are also working on developing them those with experts.
All right, Sua, thank you for that. We'll
Thank
see you
you.
again tomorrow then. Now, in this next segment, we turn to Canada, where more than 40,000 people have tested positive for COVID-19 and nearly 2,000 have lost their lives. For more on the situation there, I have live on the line a graduate student studying physiology at the University of Toronto. Welcome to the program, Ha-Kyung-Won.
Hello, I'm Juan, and I'm studying physiology as a master's student at the University of Toronto right now.
Well, welcome to the program, Juan. Juan, let's begin with the situation in Canada. I'm aware that the government has imposed a lockdown and closed its borders. How is the public responding to these measures?
Well, the public has been responding really nicely in a couple of weeks because the lockdown has started in mid-March, where people are very confused. People were worried about the risk of infection and how long it's going to extend, but the Canadian government has been responding really nicely, and Justin Trudeau has been informing the public and all of the people every day about how the situation is turning up in Canada.
At the start of the pandemic, Juan, Canada was considered to be relatively safe. What factors do you believe might have led to the sudden surge?
Well, because North America, we both, Canada and America, thought we wouldn't be expecting this much of an increase of confirmed cases like China or other Asian countries. The first response was very mild, especially Toronto Pearson Airport hasn't been screening for fever from people traveling back to Toronto in mid-March. Thus, I thought that was one of the reasons why sudden increase of confirmed cases in Canada has appeared. Also, the lack of masks in Toronto and all over the country has somehow contributed to increase of confirmed cases. Like Korea, in Korea, a lot of people, most of the people are wearing masks outside or even inside. But in Canada, even in late March, Asians were the only people who were wearing masks, and a lot of people think and still believes that wearing masks is a proof of infection, not for preventative measures.
Oh, I see. Well, you work as a researcher at a local hospital there. I understand that testing in many Canadian provinces is limited to healthcare professionals and other frontline workers such as caregivers. Does this mean that people outside of these targeted groups cannot be tested even if they have symptoms?
No, it's not true. Although we have priorities to essential workers and healthcare professionals, it is very different for every provinces in Canada, where in Alberta, you may have to call them for tests, but in Ontario, certain priorities exist, and there are a lot of people in Ontario, thus it is hard to test for asymptomatic people. But if you do have symptoms such as fever or respiratory illnesses, or even coughs or fatigue, or any of the symptoms that would lead to COVID infections, you are eligible for the tests.
One, there was a very tragic shooting incident in Canada that left at least 18 people dead. I understand authorities are looking into a possible link to the COVID-19 crisis. Is that true?
Well, because the suspect died at the scene, he was shot dead at the scene of the mass shooting in Nova Scotia, so nobody can confirm the motivation for the mass shooting. However, because a lot of violences, especially domestic violences, are happening due to increased anxiety and increased stress due to this lockdown, it is partially the reason why that the shooter may have been triggered to actually shoot people in Nova Scotia the other day.
One final question before you go. You just spoke of domestic violence. Cases of racial violence or racial phobia have been reported in quite a few places. I understand that you've experienced one yourself.
Yes, I have actually experienced one of the racial comments because of COVID, not because I am an Asian and a female, but because of COVID, because I was wearing a mask the other day. I was wearing a mask and I was heading to a grocery store, and this white old man just ran in front of me and told me to take off the mask and go back to my country and call me a chink. Obviously, chink being a racial comment, I have fought against it, but there seems to be increasing incidents of racial comments or racial violences due to this increased anxiety and stress because of COVID situation.
I see, Won. That must have been quite, that was quite unfortunate then. All right, thank you very much, Ha Kyung-won, for being with us at this later. Hope the best for you in Canada. Thank you for joining us.
Yes, thank you.
Over in the United States, testing positive for COVID-19 does not mean an immediate confinement in a medical center. We have the story of a Korean family currently living in New York whose father tested positive for the virus and the events that unfolded prior and before being informed about his state. Let's take a look.
여러분 안녕하세요. 반갑습니다. 와.
아빠 따뜻한데?
어젯밤이랑 비교해서 어때?
지금 아프지? 어제는 추웠어.
No, do you guys have an appointment though?
I do.
Yeah, it's worse things to worry about, my friend.
So this is the thing. I have an appointment.
Okay.
My wife drove me because I'm feeling so weak. But,
Okay.
Should she get tested as well with the kids or no?
That's not the opportunity, isn't there? You have the appointment. That's all that's going to happen today. Good. Good. Just feels like you have to sneeze. You're doing great. Almost there. Good. One more.
So it takes about 7 to 10 days for the results to come back.
Okay.
All right. If you develop any shortness of breath that rest,
닥터야
go to the
되냐?
restroom.
아플 때 타이레놀 먹고 있고 애기들 신생아 때 쓰려고 산 온도계 남편이 아주 잘 쓰고 있습니다.
아빠 안 아파?
아파 아직도. 엄마가 아픈데도 이렇게 일 시키려고 그래 엄마가. 어?
남편을 독방을 주고 남편 혼자서 밥 먹고 같이 생활 안 하고 남편이 나와야 될 때는 마스크 쓰고 다니라고 하는데 아직 확진이 난 게 아니니까 이게 검사 결과가 늦게 나오니까 좀 이런 부분에서 답답한 것 같아요. 오늘은 남편이 코로나 바이러스 증상을 보인 지 5일째 되는 날 닥터한테 따로 전화해서 약을 지어주셨어요. 약 이름은 현재 키친타올 4개, 클로락스 와이프스 3개, 라이솔 공기에 뿌리는 스프레이, 그리고 N95 마스크 4개 정도 남아있고 코로나 때문이 아니라 그냥 평소에 집에 있던 것들로 연명하는 거라서 사실 지금 살래도 다 품절이라서 살 수가 없잖아요. 어제 저녁에 확진자라고 연락을 받았습니다. 예상은 했지만 그래도 마음 한켠에는 아니겠지라는 조금의 기대도 있었던 것 같아요. 진짜? 남편이 확진 판정을 받을 때까지 만 4일의 시간이 걸렸잖아요. 그 뒤로 안정세를 보이기 시작했어요. 아무쪼록 이 긴 싸움 전 세계가 하나된 마음으로 본인의 몸, 정신, 마음 건강까지 잘 챙기면서 이 코로나 블루를 현명하게 이겨냈으면 좋겠습니다.
우리 국민의 입국을 금지하고 있는 나라에 대해 사증 면제와 무사증 입국을 잠정 정지하고 불효 불급한 목적의 외국인 입국 제한을 확대하겠습니다.
In today's studio discussion, we take a look at efforts to contain the virus by closing borders. Korea itself imposed entry restrictions last week after noting a surge in the number of imported cases. I have Professor Andray Abrahamian from George Mason University, Korea. Welcome, Professor.
Thank you.
And I have Andrew Salmon, a journalist for Asia Times. Hello, Andrew.
Hello.
I'll start with you, Professor. You recently marked an end to a self-isolation period after returning from an overseas trip. Could you walk us through the formalities that you came across at the airport?
Yeah, so I made the dubious decision to go to Britain in early March, and upon coming back, the quarantine system was in place. And what that meant was at the airport, travelers are segregated basically by visa type. So I went into a pathway for long-term residents. We weren't tested at the airport because of the time of day we arrived. At other points in the day, you were tested at the airport. We were taken to a facility, very comfortable, the kind of place you might take a company or high school students for a weekend away. We were given the test. We spent one night there, and then we were sent home to do 2 weeks in our homes.
I see. What did you find to be most impressive of that experience?
The fact that it was provided to everyone, so the fact that it was comprehensive, I think has given a robust shield to this country from imported cases. And to be honest, it wasn't perfect. So the KCDC and your local government are responsible for you while they're in quarantine. And they didn't seem to have exactly the same information. But because they built in this redundancy, there are two institutions keeping track of you, it provided a fail-safe. So I felt like we were taken care of. And indeed, my wife became very friendly with her local government official, and I think they're going for coffee soon.
I see.
Yeah.
Andrew, I suppose as a foreign journalist, you've been covering the COVID outbreak here in Korea from the start. I've actually read some of your articles.
Good gracious.
And for the sake of our viewers, what stance did you take in your coverage, and how would you assess Korea's quarantine efforts?
Yeah, I don't take a stance. I'm reporting rather than writing op-eds. So, just been looking at it from every angle we can take. Going out, went down to Daegu Medical Center, did the on-the-ground reporting, attended the government briefings with the CDC and the Prime Minister, and just looking at the story overall. I don't just cover South Korea, though. I'm looking at Northeast Asia as a whole. So, to me, what's very, very interesting is how very well Northeast Asia has handled this compared to the EU and the US. So if we look at the three countries, Korea has done testing extremely well, extremely extensively. Korea is the gold standard for testing. For tracing, out of the three T's, look at Taiwan. They were the first country to amalgamate their databases, which enables really effective contact tracing. If you look at Japan, who're suffering a little bit of a blip now, they didn't do well on testing, but they were very good at tracing, and I think their treatment is probably world-class, because Japan, of course, is the world's oldest country, Italy being the second, and so their pneumonia treatment, and generally this virus kills you via pneumonia, their pneumonia treatment really is A grade. So if we could take the best points of the three countries in this region and export that approach to Western Europe and the US, you'd have a gold standard overall.
I see. And from those countries, talking about Korea, what aspect of the Korea's strategy or response to COVID-19 would you think was unique compared to other countries?
To kick off, it was the extremely wide testing regimen which was instituted, which everybody at this table knows, I'm sure. More recently, they followed the Taiwanese practice of conglomerating their databases. So now you've got a single database under control of the CDC, which includes police camera data from CCTV cameras, the telcos' location data of people, credit card providers, they can see where people have been spending money, which now means that Korea can trace infected persons for the previous 2 weeks in about 10 minutes. It used to take 24 hours. So that's an extraordinary application of technology.
Professor, do you share Andrew's thoughts about Korea being the gold standard for testing?
I think that's generally accepted. I think another positive here, compared to certainly the US and the UK, is there's still a considerable degree of respect for science and for experts. There's a lot of skepticism on both those fronts in the countries where I'm from. And so that has meant, I think, bigger buy-in into what the scientists are telling us to do here. And I think the government made a key decision early, which was to have a daily press briefing from the scientists at the KCDC. When you look at the UK or the US, it's the politicians front and center, and that politicizes this pandemic in a way that I think has been largely avoided here, certainly for the past few weeks.
Andrew, as of April 22nd, that would be tomorrow, that was yesterday, a total of 183 countries have either banned or restricted entry of travelers from Korea. Now, up until last week, Korea kept its borders open, of course. What are some of the diplomatic factors at play when countries decide to either close their borders or open their borders?
Well, I mean, let me compliment South Korea for two things. One, they haven't just kept their borders open, they've kept their front doors and back doors open. We are not in lockdown. And so I'm now considering myself extraordinarily fortunate to be living in South Korea when if I wish, I can walk out of my front door and have a coffee. That's not the case for my brother and sister-in-law in France, who are in complete lockdown. I spoke to them yesterday. As regards travel restrictions, I mean, look, we are in what is clearly an unprecedented global situation. I've seen nothing like this in my lifetime. I'm pretty sure neither of you have either. I think we're going to have to just put up with these things, and what the diplomatic ramifications of them down the line are, I don't know. I suspect probably nothing much. What we have seen, of course, however, and what is a risk going forward, is those countries which traditionally have animosities, so I'm looking at China and the United States, and also Japan and South Korea, there has been some diplomatic friction over border closures. The Chinese yelled and screamed when Donald Trump closed American borders, and of course South Korea yelled and screamed when the Japanese cut off Korean travelers. So there are some issues, but overall, you know, we're in an unprecedented situation. I think the vast majority of people, diplomats, politicians, would accept that these border closures are a necessity right now.
Professor, because of these border closures here in Korea, we have seen statistics that show inbound travelers to the country has dropped by over 70%. What do you make of this?
Well, I think that's an obvious response to the fear that people have and the perception that it's simply not safe to travel. Not to mention the restrictions that are put in place. I wonder if perhaps some countries that do seem to be on the leading edge of controlling or at least containing this virus might begin looking at reciprocal arrangements to boost travel and contact. So between, for example, Taiwan and South Korea, or South Korea and New Zealand in the coming weeks. Certainly industries reliant on tourism would like to see some of that creative thinking. I think the airlines would be happy to have routes increased to some of these places. And I think you're going to see certainly the middle classes in all these countries that are quite well developed looking for holiday options in the coming 6 to 8 months. So there might be, you might start to see pockets, bubbles of countries recognizing each other as safe and increasing the contact. Before then, perhaps more visas for business travelers or other important people doing important work. We might see that in the coming weeks as well.
Andrew, do you share the Professor's thoughts about Korea easing its borders, given the fact that its numbers of infections are on a decline?
I can't speak for this. I'm no expert. I report this. I don't give policy advice. But I would suggest that as we're now seeing so many Koreans returning from abroad to be here, and these are the main numbers of cases now, we're seeing imported cases. Maybe it's a little too early, as the Prime Minister keeps saying, to relax the guard on that front. That having been said, maybe from next month, if we're seeing a continued downward trend and we've got good quarantine inspections at the airport, good. But I think really the time to do this might be summer, which is traditionally the travel period. That gives you a breathing space before the summer, when we might see a much wider increase in travel. So I would suggest at this point, continued caution would be prudent.
There's so much we still don't know about this virus, right? New information, models changing on a week-to-week basis. So it's so hard to predict, especially for people like us who aren't scientists or just observers, really, of the political and social ramifications of it. Yeah, so we're in a period where things certainly look good here, and I think the government is rightly cautioning people not to let their guard down, and we're not in a place of normalcy just yet.
But I would add that the sector which is absolutely being devastated by this, my family is in it in the UK and France, is tourism, hospitality, catering, travel. And we should really be thinking and hoping and praying that by the summer the worst of this is past and that sector can return to life. Otherwise we're facing absolute devastation, especially in so many small businesses, mom and pops, which dominate this sector.
That is so true. Andrew, in early March, you talked about this. Korea responded to Japan's travel restrictions by suspending its visa waiver program for Japanese visitors. What are your views on the possible diplomatic rows that could arise from COVID-19?
I think in terms of Korea and Japan, I'm actually moderately positive. If we look back at what happened last year, which was an unprecedented diplomatic and trade row, both sides actually pulled back and were quite wise. The Japanese had announced that they would restrict the export of these key semiconductor components. In actual fact, they allowed them through their process. They just slowed down the export of them. So none of the Korean semiconductor firms actually faced any kind of supply crisis. And Korea, of course, did a U-turn on withdrawing from GSOMIA, the intelligence sharing agreement. So both countries sort of cooled it down, and I would seriously hope that that will continue in the aftermath of this situation, when the economic challenges will be absolutely stratospheric, and we're going to require as much cooperation and coordination as possible, and any animosities should definitely be put aside. So let's hold out for good sense in both Tokyo and Seoul.
Professor, this is just a question. Your personal thoughts, of course. What are your thoughts about attempts right now in Korea aimed at easing social distancing, easing containment efforts?
Again, listening to what the scientists are saying, it seems as if we may be, until there's a vaccine, entering a period where restrictions are tightened and loosened according to how many cases there are in the general population. And then it kind of does become a political judgment. How many daily infections are politically acceptable to tolerate? You know, what is the consensus going to be on that? And we kind of have to wait and see. And in terms of going back to normal, in some ways, you know, we may never go back to the way things were in 2019. But that's not just a negative thing too. I think we're going to be having conversations about universal basic income in a new way after this passes. I think the options for telecommuting and working from home need to be discussed, especially here in Korea, where the birth rate is so low. And fundamentally, if you want to have people making more babies, you're going to have to make it easier for them to work, more flexible arrangements. So I think looking not just a few months, but a couple of years down the road, perhaps we'll look back and see this period as giving birth to some real positive changes and more babies.
Andrew, one article that you wrote about Korea's response to COVID-19 touched upon the low death toll here. What was some of the
low
death toll from COVID-19?
Yeah.
What were some of the key points in that article?
Well, I mean, this goes back to what we were discussing earlier. The earlier treatment you have, the better you can treat, and that comes from widespread testing. And Korea was, in a strange kind of way, rather fortunate in that the main cohort here, the biggest outbreak, was in the Shincheonji church. And it was their strategy to recruit very, very young members. So a large number of the early cases in Korea were young people who would be the most likely to recover from this with minimum or even no symptoms. So I think those were the key elements. But yeah, I mean, you've got to look at the 3 T's. Testing, tracing, treatment. And I think now we're 3 months into this crisis, Korea's probably on top of all 3.
Professor, there was an interesting study that showed that they were taking a study on what jobs or job types were benefiting from the non-face-to-face interactions and what jobs were not. Of course, those in the airline industry, tourism, they were suffering the most. And the interesting find was that those in education, they were benefiting. That job was most feasible to be able to done at home. Do you agree? Because I have kids at home who complain about online classes, saying their eyes hurt, their ears are hurting.
Yeah, it's a curious thing because you don't get the social cues from video conferencing that you do in person. And so I think a lot of people complain it's more exhausting. You know, you're searching so hard to understand what people are trying to convey from the other side that after I do a class of an hour and a half online, I'm pretty tired. And these are adults, obviously. These are university students as well. I think ultimately it would be nice in a few weeks or months to go to perhaps reduced face-to-face classes because you can't quite compensate for it entirely yet online.
Of course.
So perhaps a mix in order to reduce contact between people, but still have slightly more face-to-face interaction.
A balance of the two.
Yeah, that would be nice. I don't know if we'll be able to get there.
We'll keep our fingers crossed for that. All right, Professor and Andrew, thank you so much for being with us today. And that is all the time we have for today's edition of COVID-19. Do join us again tomorrow at this hour for a look at the events that led to Korea's easing of its social distancing campaign and efforts in Singapore aimed at containing its second wave of infections. In the meantime, do reach out to us through our social media accounts or homepage, arirang.com. Thank you for being with us.